Good evening. Hello, everyone. We are back, the Doty Report, and I am your host, your moderator for tonight, Yolanda Givens. Thank you for tuning in. So excited about this conversation. We are going to be discussing mental health. I have some great panelists with a wealth of information, a wealth of knowledge, and they are definitely ready to share um, all we need to know, as much as they can share about our mental health, our mental wellness, our mental wellness. Our mental health is about how we think, how we feel, how we connect, how we function. It is so very important, and many times, and I'm sweating, many times we do not realize how important it is to our everyday lives, and we don't make it a priority enough. So we are here to have some conversations. I already got some questions from folks who wanted to have their questions answered about mental health. Thank you so much for tuning in. Please feel free, those that are viewing, to jump in, ask a question, and myself, one of the panelists, will make sure we do our best to try to answer your question. Before we begin, I always like to give a shout out to the founder and CEO of the Georgia Doty Comprehensive Health Organization, Mr. Don Doty. Hey, Mr. Doty. And I have to always give honor to his wife, Joyce Doty, who is always by his side. Hey, Miss Joyce, how are you? And a big shout out, to the board of directors of the organization for continuing this platform. Check them out, georgiadotyhealth.org. I want to say hey and give kudos to the chairman of the board, Mr. Jack Orlow. I appreciate, and I'm sure our viewers appreciate, you continuing to put out this show with tons of health information, resources, and conversation. So let's get to it. Let me bring on our guests one by one, and we can get the discussion started. I'm going to first bring on Kim Alvarez. Kim is hi Kim, looking so beautiful. Kim is a former mental health nurse, and she is a veteran, you guys. She is a veteran of not just one branch. She's a veteran of the Air Force and the Army. Is that correct? That's correct. We can't hear you. Unmute. You muted.
That is correct, Yolanda.
Super excited to have you. I know you have a wealth of information to share. I'm going to bring in our next guest, Miss Mikkita Moore. Mikkita is a transparency motivator. She is the founder and CEO of The Art of Transparency, a nonprofit organization that's doing some phenomenal across states, not just in a community, across cities and various states. Welcome, Miss Moore.
Hey, everybody. Thank you for having me.
Oh, I love that red. I love that red background. I am going to bring on our next guest. She is Miss Doctor. Let me get it right. Dr. Nicole Scott. She's a counselor, an educator, a coach, and she is the CEO of Finally Free to Be Me, right?
Yes. Good evening, everyone.
I love it. I love it. I love it. And our final panelist, and I'm hoping I get her name right, so forgive me if I don't. I want to bring on, she is the president of clinical services at Loretto Hospital, Hira Hasnain.
That was very close. You can just call me Hira. That's the way that works.
That Hira.
And thank you, Ms. Givens. It's a pleasure and an honor being among such amazing women.
Thank you. MD, CDIP, CPHQ. That means she got a whole lot of information. That's what that means. That's what that means. And I am so honored to have all of you beautiful, well-educated ladies. And ladies that want to give back, obviously, to the community. I always feel like, as the host, as the moderator, that I'm representing the community, and I want to ask those questions that we want to know as a community, and I want to ask questions in a way that we can understand. We know, you guys know, obviously, that mental health, it's something we need to have more conversations about it. We need to talk about it in our home. It's affecting our homes. It
Yeah.
affects the workplace. Obviously, it is affecting our community. And if you think you had never experienced mental health, I know everybody experienced a little mental something going on last year. That definitely played a big role on, our emotions and just what was going on in our life last year. So but we're moving forward, hopefully moving forward. So I want to get right to the discussion and ask you guys. I may, ask a specific question to one of you, but I'm going to first throw out the first question of just and why do you think? I'm gonna ask the first question. Why do you think there's a stigma when it comes to mental health and mental wellness?
Well, I can start. Sorry, go ahead.
Oh, okay. I think it's because a lot of people have not been well educated on mental health. That's my reason.
Okay.
Mhm.
Okay.
And I also believe it has a lot to do with our upbringing, and not just our upbringing, but just the history of, our people, especially in the Black community. We were, in bondage, we were forced to, do things, against our will. I know for me growing up, I wasn't allowed to, be vulnerable in a sense. I was taught that I had to be strong, regardless of being a little girl, crying wasn't really something that, was appreciated or respected in my community. So as we manifest as adults, then you kind of carry that into your adulthood, like I'm too strong, I don't need this, or we associate having mental health issues with being crazy or something being wrong with you. So I think it's a litany of issues that puts that stigma on mental health.
Right, absolutely.
It definitely goes back to when you were a kid.
And
that whole what happens in this house stays in this house type of mentality. So when you are going through something, you can't talk to anybody about it because now you're worried about what they're going to say or what they're going to think. So I think there's a whole plethora of things as to why we just don't talk about it.
Right.
Yes, and coming from a healthcare perspective, I think one of the biggest disservices that we've done as a nation as a whole is that we have somehow separated mental health from just general health, that it is entirely a separate thing. When the truth of the matter is that mental health is part of your health. It is as real and as important as physical health. But we've somehow differentiated between the two and we treat them separately, that somehow one is more important than the other when it's not. It is just as important, as holistically, to treat yourself. Sound mind, sound body. That's the way it should be. But that's somehow along the way we separated the two, and I think that certainly plays a role in how we see it.
Right. So let me ask you a question, because I read somewhere that 1 out of every 5 people will experience some level of mental illness disorder in their lifetime. Is that the case?
Yes, that's true.
That's true. That's true. So that is that's like one of us. We're just 5 here, so that's like one of us. So
Absolutely.
how can we so I'm gonna go back. So sometimes we say, and we say it very casually, like, man, I'm depressed. But what does that really, really mean? And how do we identify if it's something that needs to be addressed versus, I'm just having a sad day?
It took me a long time, right? It took me a long time to separate those. Well, I'm just having a bad day versus I'm really depressed, right?
Not okay. Yeah.
In 2014, I was diagnosed with clinical depression.
Okay.
I was on, you know, the Xanax and all of that good stuff, right? But as I kind of got better, so to speak, it's an everyday decision to be happy today. It's an everyday decision to, okay, Mikkita, you can't talk about that or you can't go down that road because it'll kind of put you under, right? That dark place will come back. And it's so easy to hide in the dark place. It's real easy. And what I do for a living, you know, going from city to city, talking about that story, I relive it every single month. However, it gets better, but it's a decision to me. I know it's, you know, it's deeper, but every day I have to make a decision to be better. Every day.
So from a health care professional, how do we know the difference versus me just having a day and saying, you know, or a week, you know, saying I'm depressed versus someone who should definitely reach out and seek some sort of support?
I would say when there's a chronic depression and there's acute depression. Chronic would be when you're in the bed all the time. You don't take care of yourself. You don't like comb your hair, brush your teeth. You're always in a dark room. You don't feel like eating. The things that you used to care about, you don't care about anymore. You don't answer your phone anymore. It's you're just enclosed within yourself, and you sleep all the time. And that's when it's chronic. That's when you need help.
Okay.
To me, I often one of the things that I tell people is the presence of a stimulus. For example, if something happened, if there is a life event in your life that results in sadness, such as a death or you know, a change in your lifestyle, and you are down, that is sadness. But if it persists beyond a certain amount of time, you know, if you persist in that feeling of hopelessness, of helplessness, of wanting to retract from your friends, from your usual life, the things that bring you joy no longer bring you joy. Honestly, it's time to seek help. And it's okay, acute or chronic, it doesn't matter. If you feel like it is affecting your life, it is changing the way your perspective on life, seek help. It's absolutely okay.
I like what you said that it is okay, because I think it's important for people to understand that it really is okay to not be okay. You know, we're human. We're human, and it's nothing wrong with seeking help or, you know, seeking to just talk to someone, because my understanding is, you know, if our mental isn't well, then how can we function? You know, how can we function? So I'm going to go to our community, and particularly in minority community or the inner city community. And I want to ask a question about, and I'm going to take Chicago, the violence that's happening in Chicago. Is there something going on with mental health that's playing a role to what we're seeing in the city that we live in?
Yeah.
Hey, Dr. Nikki. I see Dr.
Yes,
Nikki.
I absolutely agree. And it's kind of similar to what's going on in Philadelphia right now. You
Mhm.
know, at the end of the day, I always say, like, you know, when you don't feel good about yourself, you can't expect people to make great choices, right? You know, me at the basic level, being a professional and suffering from, you know, depression and mental health issues at one time, I didn't make great choices, right? So, you know, we're talking about, you know, systemic change. Well, how is that going to happen? But they're never addressing mental health. Like, that's a huge piece of it, right? You know, you can talk about trying to get guns off the streets as much as you want, but if we're not addressing the larger issue here, you know, the education system, you know, the mental health of, you know, of these babies and of adults, then how is anything ever going to change?
Right.
Yes.
And I absolutely agree with Dr. Scott in that, again, you've stated it very eloquently. It starts at a very young age. So it is a cultural change. It is a change that has to happen from the very get-go. And you're absolutely right. For the city of Chicago, and for Black folks in the city of Chicago, you just stated that historically, like basically, Black folks have been made to do things that they weren't, you know, that they did not want to do. This is an ongoing issue that has not been addressed. So until we address the root cause analysis, we do a root cause analysis and address the root cause, the education system, the healthcare system, the disparities within the healthcare system. If we don't address those in the long run, when those children become adults, you cannot realistically expect them to make the same choices as as other people that may have had a different upbringing or may have had the opportunities. So, and again, to come back, bring it back to the mental health arena, I believe it is so very important, again, from a young age, to let these children growing up know as a society, as a as a whole, that it is okay to not be okay. It is okay to seek help. It is okay when you are not doing well to want to find out why and to address it so that you don't make those poor choices.
Right. That is definitely just goes with starting in the home. And I think someone mentioned, how do we begin to make a cultural change? And it starts with, I think, conversations like this and making people feel comfortable about, and, and you sharing or me sharing that, hey, I had moments like that, or I've talked to someone and that it's made a difference and it helped me. But the resources definitely have to be there, and families have to have access, to those resources, not just there, but they have to be able to have access to them. They have to feel comfortable. I think that is major, that they have to feel comfortable seeking out those resources, and that they're not going to be, put in some category or judged by seeking help. So that's important. So this is the Doty Report, and we are having a conversation, a discussion about mental health. Please like, share, ask a question, engage in the conversation. We don't even have enough time tonight to really talk about, mental health in the way that we should, but this is definitely a start. So I want to switch it up a little bit and talk about, and this is a big one, and Kim, you can begin to address this, because I had someone ask me about veterans and them when they coming home and having those mental health challenges and wellness challenges. Can you speak to that? Because people, the citizens, don't really understand that, and maybe family members or even those veterans don't know how to seek the services. Can you talk a little bit about, veterans and mental wellness?
Well, yes. As far as, for instance, we have the American Sniper, a movie that came out in 2014, where we had a soldier who served 4 tours in Iraq, who came home and was killed by one of our own, and he had a mental health issue. The one that assassinated our soldier. I'm not sure if one of our panelists are aware of that movie. And so I'm with our soldiers coming home by September 2021 of this year. There's a concern of the mental health that they will receive, like the psychiatrists, the therapists. Do we have enough staff there to help them?
So that's important to know. And that, so when you said September, so we would have like is that a particular time that we have soldiers coming home? Okay.
Yes. There's a trajectory date of all of our soldiers being home by then.
Okay.
So it's the veterans that we are dealing with right now that are having PTSD. The suicide is going up, especially even more so with the pandemic. The suicide is going up. There's all kinds of things that are going on with the veterans that we are used to. We're going to having treatment at the VA center,
Okay.
That was cut off. That was cut off. So that became a problem with more suicidals going up because
Okay.
there wasn't that one-on-one treatment. So there was a lot going on with the veterans then as well.
So it
So
goes
we're
still,
just looking.
go ahead.
Mhm.
So it
So
goes back to services.
we have to look at the treatment for the veterans as far as what we're going to do with the veterans that are coming versus the veterans that we have now that we're taking care of.
That's good. It goes back to resources. I see someone ask the question, and this is always, and I've heard people, in my circle says, I'm not taking any medication. So the question is, as it relates to mental wellness, does medication help everyone, or she said, or only those that truly want to be helped? I mean, should we? I've heard people say, I'm not taking that. I'm not taking that. So is that an option? And is that well, I know it's an option. Is that a good option for some folks?
I know when I was on it, you have to wean yourself off of it. Or, like go to the doctor. It has to be weaned off. You can't take it one day and then don't take it the next. It has to be a consistency. So for it to work, you have to take it consistently. And then to come up off of it, you have to wean down. Not just, okay, well, I'm not going to take it no more. That doesn't work. And it's like any other medication too, though. You do have side effects.
Right.
Just like with any other medication.
That's a good point. I don't think people, that's a very, very, very good point. I don't think people think about that there's side effects to any medication.
Anything, birth control, whatever.
Right.
Yeah.
One of the things that I would like to point out, and Ms. Mikkita did a really good job of pointing it out, is, again, these medications have to be taken consistently. So one of the things that I think is super important for us to discuss is that medications for mental health don't work like medications for pain. There's not an instant gratification. There's not an instant relief. And you have to take it consistently in order for it to build up in your system, for it to have an effect. But I also, would like to point out, not every medication is for everybody. There are lots of medications out there. There is an array of medications. If one does not work for you, that does not mean the medications are not working for you. What that means is you should have a very frank discussion with your provider, stating that this medication makes me feel a certain way and I don't like that. It could be a side effect that eventually goes away, or it could be a side effect that's happening specifically to this medication for you, and you can change it out. But again, that's a process. For mental health medication, it's all a process. So again, there's no instant gratification of relief. It has to be taken consistently. And I always stress, holistic medicine, again, is on the side. Anything that you do in addition to that, herbal, holistic medication, wonderful. But medications are important. They do work. They have efficacy. But they need consistency, as well as being monitored by a physician, closely being monitored by a physician. It's important. Those things are important. So I think those are all things that should be always discussed very openly and frankly with your provider.
I like that. I think that's important I want to just reiterate that. One, I heard that all medication have side effects. We need to keep that in mind. And two, it's not something you could just take and, okay, now suddenly my depression or whatever the situation is gone. And probably a lot of people is like, I want to take a Tylenol so my headache can go away. And this is very different. I heard you say consistency. If your doctor happens to prescribe you a medication, that you need to do it be consistent in taking that and being monitored by the doctor that has prescribed. That's very important to know. I don't even know that. I think about, of course, it has side effects. Everything does. Everything does. What would you say? So I have another question. I'm sorry. Let me before I get this question. Someone asked me to ask the question, and I don't know, as mental health providers, healthcare providers, if you have even an answer to that. Are there requirements to get someone to a mental health facility. For example, someone we see on the street that we know, we assume that there's some mental health challenges. Is there something that us as just neighbors or citizens can do to get some help for them? I know that's a tough question.
Well,
There are some
think
quick.
it's tough, right? Because
That's
we want
very
to be
tough.
able to help everyone, right? But
Yes.
the reality is, people have to want help for themselves. It doesn't matter how much we want someone to, help. But if they don't want it themselves, we can drag them there, once a week if we wanted to. But they have to make that concerted effort. A lot of times people have to hit rock bottom. When we see people, on the street, sometimes that's not even rock bottom for them. So that's what, I just tell myself sometimes. Even my daughter will ask, and it's just like, of course, no one wants to live on the street, but I'm sure, and I tell her sometimes their family may have exhausted all options, so sometimes people just really have to hit rock bottom and decide to want the help from themselves. We can't want it for them.
Good point. I had to ask that question because she asked it in sincerity, really wondering if there's something that she could do to help those.
had
Thank you, Dr. Scott.
I had a case like that, but you can go ahead. I'm sorry.
No, please, Ms. Kimberly, go ahead.
Okay, I had a case like that once where like you were saying, that someone needed to go to, they wanted to actually commit that loved one, and that person took that person to court, and the judge says, well, you can't take that person's right away. And so, but that person was being wrong to the family, just tearing up the house. And it got to a point to where the person said, I want to kill myself and everybody in the house. Well, the police was called, and that person was then taken to the hospital, and then that person was admitted into the hospital. So that person would have to say, I want to kill myself, be homicidal or suicidal at that point, to where a doctor would have to evaluate the person for like primary care wise. Doctors will agree, and then that person will be mentally evaluated, and then proceeded on through that route.
Okay.
And I think to add to that, although I think we've covered it, is harm to self, harm to others are always reason for you to come forth, bring that person forth, because they might not know it themselves, but they need the help. But when it comes to other little things, like if you see somebody that's depressed, and you see just like a neighbor, it's not as acute a concern perhaps, but you see it happening. I always say information is power. You absolutely should bring information to the person. Again, making them feel comfortable with the fact that this is happening to them, and that it's okay to not be okay. It's okay to go to a doctor, talk about this. That kind of information can be life-saving for somebody. So, of course, if it's harm to self, harm to others, that's an acute cause. Call the police, call mental health services. But if it's something small, like still acute, again, information is power. Bring them the information. Refer them to services. A lot of those folks out there may not even know what services are out there, but more importantly, may not even be comfortable with what they're experiencing. So.
Right. So I got a question text to me, and talking about, trying to help other people, and you have to want help to get help. Is spirituality important in dealing with mental health? Does that? Okay.
It plays a role. And I think we as people, as Black people, we kind of like, well, if you gonna pray, you can't go see the therapist. No, God made therapists. God made them.
I could not have said it more beautifully.
God made them, and I'm going to see one. So I think there's a misconception. Like, well, I pray, and I'm not knocking prayer at all, in no way, shape, form, or fashion. But sometimes you do need help. Sometimes you need to just talk it out. So yeah, I think it plays a role, but don't allow it to hinder you. Because you need to go see a therapist.
Right.
Yes.
Right. Right. That it's funny that we will go to the doctor when our back hurt,
Yes.
but we won't go to the doctor when we feel some kind of way. You know.
That's because our minds are trained that way. Like when I
Mhm.
first started going to see a therapist years ago, I every time I went, I was like real sheltered, like, what we gonna talk about? What, and I would wait for her or him to ask me questions. Um, but now, and I go to therapy now just because I got a lot on my plate, right? So sometimes it's not about mental health, it's a lot on your plate. Let's talk about it. So I go now and I'm like, I'm beating him in the office, like, come on in here, let me tell you what happened. So I think all of it go together, but it is definitely a stigma.
So can someone of you share with those that may be wanting to seek some therapy or counseling and just don't know how to navigate that. Like how does that, do you go, because I don't know that, you have insurance and you look up doctors. I don't know it's just as easy as, okay, there's a counselor, I'm gonna make an appointment. I don't know if it's that easy. Like, how do you navigate that process without feeling some kind of way? Is it your primary care that physician that you start with?
You can.
Or
Yes.
okay.
Yeah. So a lot of times what happens is you do just make those phone calls, right? Because therapy is a little bit different from your family physician or your physician, because you have to connect with this person. Like if you go and you are not on a connection level, then you got to go to another therapist. Mental health is a whole lot different than just medical health, because it's a little bit more intricate. It's a little bit more intricate. Now, a lot of times you can call a therapist on the phone. What COVID did, going into that, COVID did one thing. It made the virtual world, right? So the first visit, if you can get a virtual visit, if you connect with that person, and it's easier versus going to the office and sitting there and all of that. So it's a little bit intricate trying to find a physician. I mean, a therapist, but
Okay.
it gets easy. It gets, once you get in the groove of it, you're like, oh, I like her, I like him.
Um, if I may, that's one of the things that I've heard quite often is people say, well, therapy or counseling, what they usually say is, I could just talk to my best friend. What's the difference? Why am I going to pay somebody? And I always want to people to understand is absolutely talking to your friends is a great way to, lessen your burden somewhat. But again, mental health is still a healthcare concern. So you do want somebody, you can talk about your feelings with your friends, but talking about your mental health concerns, there has to be somebody trained, somebody who is a professional on the other end, who is able to help you work through the processes, that you are experiencing, that you're feeling. I did see somebody ask a question about if I take medications, do I still need a counselor? Medications are extremely important to work out, any kind of chemical imbalance. And again, I hate the word imbalance because it makes it sound so bad, but, any kind of physiological change that's taken place within your body. But counseling helps you understand the effects of that physiology. The thing that wreaks havoc on you, the thing that makes you feel the way you do. Medications, while they work on the physical body, counseling helps you unburden your mind, unburden your soul, make you feel comfortable. And Miss Mikkita said it perfectly. You need to be comfortable with your counselor. And it's a very important to find the right one, which is why I always suggest a place where there are multiple counselors. So in the event that you don't quite connect with one, you can find another one within the same practice, because there's different people with different styles, and not everybody is going to gel with you, because you have to be vulnerable, open, and transparent.
Right. So you mentioned something. I want you, if you don't mind sharing. What is, because people here and don't really understand it. What does that mean when you say chemical imbalance?
Um, So, I mean, depression and anxiety, those are not just things that we feel,
Right.
but also, neurochemicals within your brain might not be where they need to be. Serotonin is something that makes us feel good, but if it's not being, detected by our brain the way it normally should be, if that is something that is different in you, I mean, and again, some people may say, whoa, that sounds really bad. It is no different than,
Right.
say, having high blood pressure or
Right.
having diabetes. Your body not, being able to detect the insulin. Same thing. Your body not being able to detect that serotonin. So you may need to rely on medications such as, selective serotonin reuptake inhibitors, etc., in order to feel better. And that's the physiological part of mental health. But again, you may be somebody that doesn't have any of that. And all that you have, as Ms. Mikkita said, a lot on your mind. Sometimes we just have so many processes happening that it's really hard to pull all those threads together at one time and hold them. And I tell people all the time, just like information is power, prayer is strength. But God can be your strength, and He's got you. He's holding your hand. But just like when you get a boo boo, you put a band-aid on. You still got to go to the doctor when you got back pain. Go see a doctor when you're having difficulty with your mental health.
Right. I love that. Yeah. And I asked that question because I want to make it so that it's not like, oh my God, that's something bad. I want, those that are watching and those that struggle with how to be open-minded about it, to understand that it's not bad. We are just humans. I want to ask Dr. Scott, who counselor coach, what have you seen or experiencing as with people? Like, what is it, what's going on? Are we people depressed about jobs or money, or is there some trend that you're seeing that is affecting the mental health of our homes and in our community that you've seen?
I think it's a culmination of everything, right? The pandemic started a perfect storm of just everything just falling apart for a lot of people. So first, you lose your job, then you don't have money, then your finances are struggling, then you're having issues with your home because now when you were at work, now you're stuck in the house with these people 24/7. So it was just, like I said, a whole new set of issues that have been created for a lot of people. And then, another trend that I've been seeing is just the whole suffering and silence piece. People feeling that no one else can identify with what they're going through. No one can understand what I'm going through. And like I said, and because we were just raised that way, that you have to be strong, suck it up and keep going. People do that, and then by the time that they actually realize that's an issue, then they're so far down, in depression or under the ground, that it's so hard to kind of start to peel those layers and do the work. So, that's why it's always important. And if you wish that as you're going and you feel yourself reeling, that you can kind of be aware of it, but more likely than not, you don't notice it until you're all the way down and, down the drain. And I know that even happened for myself. So it's kind of just one of those things. And I saw there was a question of, can you prevent mental issues before they start? In some instances, like I said, if you have the wherewithal to know that it's important to take care of your mental health, and then, you start seeing a therapist before issues arise, then that's amazing, like I said. But more often than not, you're really, so far down, the drain before you really, start taking your mental health seriously. So, like I said, in some instances, I would say yes, but for a lot of people, like I said, this pandemic was new. For most of us, we never went through anything like this. So there was no playbook, no rule book of what to do. When you felt lonely, or when you got fired from your job, or when your marriage was going down the drain. So, we all basically learned together.
Right. Someone brought up a question. I was just finna talk about that. And the question is, can we also discuss effects of trauma and what trauma is, the attributes to mental health issues? I was just gonna go there because we know in our communities there's a lot of trauma that we don't even acknowledge as trauma. So
PTSD.
uh,
PTSD.
PTSD. So the question is, let's talk about that and the effects of trauma and mental health. Anybody want to, start us off with that discussion about trauma and that connection to the mental health issues.
I would like to just address that Dr. Scott actually mentioned something right at the beginning of this conversation about sometimes because of our mental health issues, we tend to tell ourselves, I don't need anybody. I got this. I'm going to do this on my own. That hyper independence is often the result of trauma and often the result of childhood trauma. What happens is that during our childhood, we've been let down by folks close to us, important to us. And when that happens, we learn along the way to not ask for help because we've been let down by those people that were important to us. So what results in this is our guards being up. And I tell these folks, I think I've probably worn people down with the saying, when you build walls around you, you're not just keeping folks out, you're keeping yourself trapped in as well.
Right.
That's what happens with mental health issues. You are suddenly find yourself trapped and you've been there for so long, that becomes your norm. And like Dr. Scott said, you're all the way at the very bottom. You hit rock bottom before you even start realizing how far down you've gone. So trauma, this hyperindependence, I don't need anybody's help, I got this on my own, is usually the result of trauma we experienced along the way, but especially during childhood.
Wow.
So it is important to get that help, to seek that help when you have been victimized. And I don't, again, like using the word victim, but as a society, and ladies, again, I don't want to overstep my bounds, but especially within the Black community, and I'm not the one to be able to speak to that, but as within healthcare, we see this happen culturally. That happens a lot. A lot of childhood trauma is just smoothed over, forget about it, swept under the rug. And then when we become adults, we forget. We never develop a good way to ask for help. And that results in us never being able to address those mental health concerns. And again, being very honest, that first discussion starts really with your primary care physician. You don't even have to go finding a counselor. You just have to be able to say, I'm not okay, to a professional who is able to say, okay, what does that mean for you? Does that mean medication? Should I give you a referral to a psychiatrist? Should I give you a referral to a psychologist? But it is very important to have that connection with your primary care physician, and be able to be open enough with them about these things.
Right. Absolutely. That was definitely a good statement to make about those feelings that you have an adult is really for something that possibly some trauma that happened in your life as a child. And I think it is important for parents to hear that, because I think we do, kind of do that. She'll be okay.
Your children, they'll forget about it.
They'll forget about
and
it.
We don't realize that those things happening at that age are affecting us way down the line as adults.
Wow.
They have lasting effects. So it is important to be open. There are, and I cannot stress this enough, there are adult counselors, but there are also children counselors. Please know that your children can get the help. And you don't have to feel guilt that your child is going through this. Absolutely not. You wouldn't feel guilty if your child had a physical illness. You would just go get them help. This is no different. Even if it is the result of a trauma, parents have to understand it is okay. If the trauma has happened, I still need to get the help.
Right.
Don't feel guilty. You getting the help is you being a good parent.
Right. And it's important for parents to hear that, and especially when we talk about the violence that's going on in the city of Chicago and across the states, period, that we get very desensitized. But are we really desensitized, or we just kind of, again, brushing it back? But it ends up playing out in some other way. And a lot of times not necessarily a positive way. And Kim, you mentioned PTSD, and I want you to touch on that a little bit, because I know there was a time when people associated PTSD with veterans. Only veterans have PTSD. Is that true? Like, I don't think
Not true at all.
that's the case.
We're saying with childhood trauma, a lot of it can definitely come from childhood trauma. Like you see your sister, your brother that was killed in the street, or you can see a police officer that would, for instance, have their knee on the neck of a person. You see that happen. That's a childhood trauma. Something you have seen something happen to someone, or something has happened to you, can result in PTSD.
And I love that it was mentioned that we think that kids forget,
Yeah.
but they don't. And if we really thought about it, kids are like sponges. They absorb everything. They don't forget anything. So that was a very good point for, especially for parents out there, and even for us as an adult, to say like, why am I behaving this way? Where did this come from?
And you're absolutely right. I think to take it just as one step further, if you're the parent of a child who has experienced trauma, chances are the way that makes a parent feel. I mean, let's be honest. When a child stubs their toe, it hurts you.
Right.
And if your child has experienced trauma,
right.
chances are, as they parse through what's happened to them, you will likely also need some help parsing through how you feel for not having prevented it, or it having happened in front of you. So this might be a shared experience, and instead of you both, helping yourself with the help of a professional, of course, through it, sometimes people are just like closed up about it. Again, I cannot stress enough, mental health is no different than physical health. If you saw your child break a bone, you take them to the doctor. If you see your child struggling, their behaviors have changed, they're more aggressive at school, they're biting, they're spitting, little things, little behavioral changes, it's time to recognize that they might be a cry for help. Something might be happening that needs to be discussed. And again, it doesn't just need to be discussed within the confines of four walls. A professional can help you really bring out what's happening, the root cause of it all. And what I would like to really stress at this point is, I mean, we at the Loretto Hospital have a very robust inpatient psych.
Okay.
But a lot of folks may not know that at the Loretto Hospital, we have an amazing outpatient mental health center. We have multiple counselors that you can see. We have an open roster. We have lots of availabilities, and we welcome everybody from the city of Chicago, from the West Side, but everybody. And just to take it back further, we also have primary care physicians. We have availabilities for preventative care. It's really important, and we welcome everybody. Come see a primary care physician, talk about your health, talk about your mental health. Let's see how we can help you. You don't have to do this alone.
That's very, very important to know. And as we're getting close to coming to the end of the show, I want to ask a question, some helpful. What are some things that, and we said some of it, but what are some things that people can do to support their mental wellness?
Get help.
Get out.
Get help.
Talk about it. Talk about it. Sometimes it just starts with a conversation with your friends, but talk about it. Know that you do not have to do it by yourself. It's one of the things that one of quotes that I love by Glenn Close, everybody knows she's an actress, is what mental health needs is more sunlight, more candor, and more unashamed conversation. And to me, that's the crux of it. Unashamed conversation. There is no shame in you having mental health.
I love that. No shame. No shame. Kim, you were going to add something?
And know that you're not alone. And like you said, definitely know that you're not alone, because you have people that say, "Oh, just pick yourself up. Oh, don't worry about it. Just pick yourself up." Well, some people are able to do that, but a lot of people can't. A lot of people can't. And it's okay.
Right.
And I would just, end by saying just make self-care a priority. Self-care is not selfish, and being vulnerable does not make you weak. It is one of the most, awesome signs of strength that you can have. So that's what I just wanted to leave everyone with.
Absolutely. Self-care, get help. Let's talk about it. Let's seek out the resources. Let's get our kids and our young people, let's recognize that they too are dealing with a lot of traumas, especially with social media, being able to see so much, just not even in your homes, but now we get to see everything in everybody else's home.
Yes.
So, and to be able to, address those things and ask your child how they feel, about the things that are going on. I know my grandchildren, and I'm sure many others, having to stay in the house for a year plus, you did not socialize with your friends. What? And you think that they don't you that doesn't warrant at least some parent child conversation, I would think. And now that they're going to transition back to school, as a healthcare professional, what would you say to what could be helpful as kids are transitioning back to school after a year and a half?
Personally, I think the conversation, the crux of it all is the same. Talk about it. So it's okay to not be okay and talk about it. I mean, to me personally, especially in the city of Chicago, West Side, etc., we have 3 pandemics in Chicago. COVID is just one of them. We have violence and we have systemic racism. Imagine your child having to go through that. Any family member at any age going through that.
Right.
That's tough. Especially in the past year and a half, I think there's been a lot of mental health anguish. There's losing jobs, the constant negativity in the media, the things that we've seen, the constant pictures rolling, knees on necks, etc. These are very difficult. It's difficult for us as adults. You can only imagine. I can't fathom what kind of effect it has on children, the youth. So to me, the biggest, most important thing is it starts with us. It starts with us normalizing it so our children can learn those healthy habits at an earlier age. Mental health does not just affect us. It affects children, youth, people of all ages. So recognize it, teach your children that it's okay to talk about it as children and as they grow up. And it's okay to seek help. You get them yearly wellness checks for school. It's not that different. Check in with them from time to time to have those discussions and say, how do you feel? What's bothering you? What can we do differently? Do you need help? Those are all important things. And again, I cannot stress this enough. The doors of the Loretto Hospital, especially around patient mental health, are always open to the city of Chicago.
Right. I loved you saying you get a physical, your body every year. Why not just let's make it a mental health, get mental health exam, evaluation every year. Make it a yearly thing. We have to have that physical to make sure our body and all of that is okay. Let's do the same thing for our mental, our emotions, to make sure that we're okay. So I know we've said a lot. You guys have shared so much, so valuable information, but I want to go one by one and give the final words. Kim, what are your final words to our viewers as it relates to mental health and mental wellness?
Never be ashamed of health, because no one is ashamed to have diabetes or cancer. Just like all the organs in our body, they get sick. The brain is an organ in the body just as well. It can get sick just as well as our liver, pancreas, kidneys. So just please get help. If you feel like you're not feeling well or suicidal, just get help.
Love that. Love that. Mikkita, what are your final words?
I really want to kind of focus on the kids real quick. remember your trauma is not their trauma. A lot of times we as parents, we think of the huge traumas, but we don't think about dad not being around, or we don't think about mom not being around as a trauma.
Okay.
We don't think about those things with the kids. So just make sure you're doing those checks with the kids, because yes, we got COVID. Yes, we got all of the other stuff happening, but we also got babies right in our home that are traumatized from the other parent, or family members that promised them something and walked away. You never want children to feel like love equals abandonment. So be careful with that. And the other part of that is make sure you are checking with them all the time. All the time. I can't stress that enough. I got 2 kids here, and I remember having conversations with them. And they're like, the pandemic is this, but what about this person in my life? Or what about that? So just make sure that we're not making trauma these huge things when it's really could be very small.
Right. Good point. Which is very big.
Very big.
Very big. Nicole, what are your final words to?
I just want to circle back to the whole thing of suffering in silence, right? I think that is really important, especially within the Black community. So just stay plugged into your people, whether that's your family, that's your friends. Like I said, more times than not, we're not going to come right out and say that I'm depressed or I don't want to be here anymore, but just pay attention to those unspoken signs. Like I said, if you pay close attention enough, you can see the difference in people, whether they become more withdrawn, like I said, whether they stop answering your calls, or whether someone who used to go out and be looking like a diva every day just doesn't care anymore. So that's just the thing that I just want to just bring awareness to, that whole suffering in silence piece.
Good point. Good point. Someone says, I agree, Dr. Scott. And last but not least, you're in the hospitals. You're seeing it every day. What are your final words to our viewers?
I mean, in that same vein, I agree with all these wonderful ladies. Again, it was an honor being on this panel with you all, but exactly that. It's that some people may not know that the resources are out there. As Ms. Kim said, you are not alone. As Ms. Moore said, it's not always the major things. And as Ms. Scott said, sometimes you may not know it yourself. So your what I say, your tribe needs to be looking out for you. And you need to be the person looking out for your tribe. So, but ultimately, you may, even if you recognize it, you may not know what to do with it, because we see the hospitals, we see the clinics, but when it comes to mental health, we're like, where do I go? Where do I find a counselor? I'm going to call somebody, I'm going to stay on the phone. If all Google phone calls, all of that may confuse you. All else, put it all aside, go see a doctor. Get a full checkup. Have them understand, hey, is this physical? Is this something I just need to talk about? Go see a physician. They will be able to help you get to a mental health, counselor, mental health, a psychiatrist, a psychologist. Come see us. If you come to the Loretto Hospital, I highly doubt that there's not a resource that we have to help you with. But if we don't, we will still go ahead and find every other resource that may be able to help. Maybe it's domestic violence. Maybe it's something else. Maybe you need some legal help. We'll do everything that we can, but don't suffer in silence and look out for each other. Yes. And talk about it. Talk about it. Please talk about it. Unashamedly talk about it.
I love that. Thank you, ladies, so very much. This has been a great conversation. We could go on and we could take one topic and keep going. I definitely appreciate you. I just want to thank everybody for tuning in, for engaging. Our viewers were definitely engaging with the comments and their questions. We have to continue to have these discussions. We have to have these discussions over and over and over again to make our folks, our communities, our neighborhoods, our homes feel comfortable with seeking that help and not suffering in silence. Thank you, ladies, so much. I appreciate you. We're going to have a part 2.
Yes. Looking forward to it.
It's a part 2. Thank everyone for tuning in to the Doty Report on comprehensive health. It is always my pleasure to be the host and the moderator. And we hope that you have definitely gained something. Check out the organization, georgiadotyhealth.org. Volunteer, donate. The organization has been around for 20 plus years, and they have been a very strong, very active advocate for the underserved community as it relates to access to quality health care. So, again, I've been your host, your moderator. I will definitely see you next time. Remember, donate, put the donate sign, paypal.me/Georgia Doty. Help make a difference, reach somebody. And remember, when mental health, it's everything. It's how we think, how we feel, how we connect, and ultimately it's how we function. And if we can't function right,
Yeah.
that's all I can say to that. If we don't know how to function. Thank you. I see you next time.
Thank you, everybody.
One.
Bye.
Good night.
Good night.